My name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas and an expert in the area of personality disorders. And in this video, I wanted to talk about treatment suggestions related to addiction and borderline personality disorder. Now, this video is also applicable to those who have substance abuse issues, who don't have personality disorders, because we're going to sort of talk about certainly the personality disorder aspects, but also a lot of these suggestions and treatment suggestions can be broadened out or generalized to other types of folks who are dealing with substance abuse issues who don't have borderline personality disorder. But this also could be generalized out to those who have borderline personality disorder traits or other personality disorder traits as well. Now, the first thing that's most important is that you have to get the substance abuse under control before you can work on borderline personality disorder or any other personality disorder issue. Because if you don't, what happens is that while you're in treatment, you could perhaps get triggered. Sometimes in working with these issues, you're going to encounter a lot of stress. You're going to encounter difficulty dealing with a lot of this core content, borderline personality disorder issues. Those are the things that kind of drive you to engage in these maladaptive behaviors, to disrupt relationships that impact how you see yourself, others, and interpret different situations. So what happens is, if you encounter a lot of stress, then you go back to that coping strategy. And individuals that have addiction issues, substance abuse issues, they go to substance use. And so every time you encounter a high degree of stress, your brain sends a message that says, go get high, let's go get high, let's go get high. And that's what happens, so you fall back to that. That's why that substance abuse issue has to be dealt with first, has to be under control first. Now, what's important is, so if you feel like you have borderline personality disorder and you have substance abuse issues, the first thing you want to do is you want to ask your therapist how familiar they are in working with personality disorders and substance abuse. Because that's really important, because if folks start working, again, on the personality disorder issues and those core content, it's going to increase the probability and drive that individual to those coping strategies, which includes substance abuse. So we don't want to do that. Now, if you're searching for a mental health provider or a therapist, you want to ask them, and it's okay to ask them what they know and what they're comfortable with, what their knowledge is. A lot of mental health providers put that out on the internet, so you can learn a lot about that just by looking at their website and stuff like that. And you can get an idea how familiar they are with substance abuse and treating personality disorders, in this case specifically borderline personality disorder. Now, I'm going to give you a list. This list comes from the Mayo Clinic, and they have a lot of good resources and information. And these are things that you can do to increase the likelihood of success. Now, let's define success before we get into that. What that success would be is getting that substance abuse, that addiction issue under control, so that when you're in treatment and you encounter stress in working with your core content issues, you're not driven to engage in substance abuse. Now, you may always have that taste or flavor for it. And a lot of my clients that have borderline personality disorder, as well as a dual diagnosis that also have a substance abuse addiction or substance abuse issue. And a lot of times we're talking about things, we just say, okay, well, what is your instinct? Where are you driving to? And a lot of times they're like, go get high. Or for those that maybe smoke crack, or that do cocaine, or that IV drug use, you're like, shoot up, snort, or smoke and get high, whatever it is, that becomes their coping strategy. You have to include that in the therapy process so that you're increasing insight and awareness, because we know that folks that have personality disorders, that their insight is impaired. So they may not be reading the environment correctly. They may not be reading the situation correctly, and that stress, and handling that stress effectively. So what happens is you have to constantly be bringing that awareness to the individual or to yourself, that when you encounter stress, your brain is sending you, let's cope. Here's our number one coping strategy. Well, we want to lower that substance abuse or get rid of it altogether as that number one coping strategy. Okay, so here's some things that can help you. Now, you want to learn as much as you can about borderline personality disorder and substance abuse, and this is part of what you're doing now. I also made a video that is specifically on borderline personality disorder and treatment issues. This one is more treatment suggestions. That one is more of identification, so you can check that out as well. And because we want you to build that insight, build that understanding into the causes and treatments that can help you gain a better understanding. Now the next one, this is to learn how to recognize what your triggers, your outbursts are, impulsive behavior. This can be splitting, this can be recognizing your emotional buttons. I did a video on this. I'll put the clip right here for you so you can click that if you're interested in seeing that. Now you want to seek professional help. And when you do that, what's going to happen is they're going to develop a treatment plan for you. And you want to stick to that treatment plan as best you can. You want to attend all therapy sessions. And you want to take those medications, if you're prescribed medication, as directed. Not too much or not too little. And if you're making a personal choice to do it differently, which is go outside of the prescription that your doctor has suggested, you want to let them know. Okay, that's really important to do that. You want to work with your mental health provider to develop a plan for what to do next when crisis occurs, when things come up, when unexpected things come up and it feels like a crisis. So you want to develop that crisis strategy. And you can work to identify those different levels of stressors and the different types of stressors and add coping strategies to that. Remember, the more awareness you build, the more insight you build, the stronger you're going to be to control a lot of those sort of substance abuse triggers, the drive to use substances. And you want to get treatment for related problems. Now this, of course, substance abuse, but also you want to recognize that treatment for cutting, anger, other types of outbursts, other types of issues that you may have, just as we're talking here, which is the borderline personality disorder component. So you want to make sure that you're not just, if for substance abuse, you want to get that under control, but you want to recognize that borderline personality disorder can be an underlying component. Okay, that your core content could be these components of abandonment, emptiness, sensitivity to rejection. These are common, not for everybody, but these are common core content issues for individuals with borderline personality disorder. And what you also want to do is you want to consider involving healthy people that are close to you and in your treatment progress. And sometimes maybe bringing them to session. I've had a lot of my clients bring their significant others, their close friends, their confidants, whoever it may be, to session, and we talk about, okay, how can you help the client best? How can you build that support system? Because again, remember, what we want to do is, if your coping strategy number one is get high, we want to lower that. So maybe it's go to this healthy other, this person who is not using drugs and alcohol, who's not violent, who's not abusive, who's not rejecting. So those are the folks that we want to build your interpersonal circle with. Now another component is managing intense emotions by practicing these coping skills, such as using deep breathing techniques or mindfulness meditation, whatever it may be. And so if you've ever been to treatment, or if you're in treatment and you're learning a positive and adaptive coping strategy, a coping skill, I hope that your mental health provider has told you that you practice this not when you're in the situation that you're triggered, not in the situation where you feel distressed, but when you don't, that you practice it every day. And I often use the example of ice skating, right? So you see the ice skating Olympic team, right? That's a popular sport. A lot of folks watch that. But those folks that are on that team who've built up this level of skill, that's not their first day on the ice, right? We all know that. But sometimes we have this expectation, okay, here's a worksheet with a breathing technique or a frustration tolerance technique, whatever it may be, and we give it to that person, and they're like, oh, okay, well, I'll just use it when I'm on the Olympic stage. No. You want to build that skill. Keep practicing. Practice it every day. Practice 1 time, 2 times, 3 times, however many times you can, so you build up that skill. So when you do encounter that stress and that anxiety and that triggering moment or individual, that you can pull from these resources. And it's not going and getting high. It's not engaging in substance use. Another one is you want to set limits and boundaries for yourself and others by learning how to appropriately express emotions in a manner that doesn't push others away or trigger abandonment issues or other types of sort of interpersonal emotional instability. Dialectical behavioral training is really good. DBT is really good. There's an interpersonal skills component. There's an emotional regulation component here that is very helpful. It's very effective. You can certainly look that up. There's a lot of different exercises. You can seek out a DBT therapist, someone who's certified in DBT. They can help you learn these things, and it's important that you know what your limits are. Setting limits, and folks with borderline personality disorder have a lot of difficulty setting those boundaries and limits because of that core content of emptiness, rejection, sensitivity to rejection, and other types of issues. So what happens is that they tolerate. And a lot of them, my clients, and perhaps you're like this as well, are what we call stuffers. And stuffers are, you stuff it, you stuff it, you stuff it, you stuff it, and then, right? And then you explode because you've stuffed so much stuff that you finally explode. So once you set those boundaries and limits, you're managing smaller pieces instead of ingesting, imbibing smaller pieces that build into a larger piece, and it becomes overwhelming. Now, we want to be sure, though, that you're not making assumptions about what people are thinking. A lot of folks with borderline personality disorder, they're mind readers, and that can be a triggering instance. So they'll be like, oh, he or she's mad at me, he or she doesn't love me, he or she hates me, he or she doesn't see me as important. And that can trigger a core content issue, which then can send you to your coping strategy. And if your number one coping strategy is substance use, where do you go? Substance use. Okay, so what we want to do is we want to recognize that mind reading is not helpful for you. Resist doing that. If you're interested in mind reading, or the concept of it, not how to do it, because we obviously can't, just let me know, put a comment in there, and I could do a video if you're interested in that, on the component of mind reading, because I see that a lot with my clients that have borderline personality disorder. Now, the next one, this is keeping a healthy lifestyle. And I know that I've said in a lot of my other videos, and that's because this is really important. It's important to eat right, have a healthy diet, right? Exercise. You're probably like, thanks, everybody tells me that. You ever wonder why everybody's telling us that? It's because it's so important for our mental health for us to have a healthy body as well. For us, we know garbage in, garbage out, right? Good in, good out. And that's what we want to do. What you eat, it does affect how you think and how you feel and how you sleep and how you function. So it's really important to do that. Try to maintain that healthy lifestyle as best you can. A lot of folks write me and ask about, well, how can I find a therapist? I'll put the link to that video here if you're looking for a therapist who maybe they can help you sort of identify some of these issues, deal with some of these substance abuse issues. And substance abuse is a hard thing to contend with. And it's something that really shouldn't be pushed to the side and be like, well, I'll deal with it tomorrow, If you feel like that you have substance abuse issues, certainly consult your doctor, your physician, or talk to a mental health provider, or talk to someone who can help you and start learning to overcome it. Substance abuse is something you can get control of. It's something that you can manage. And once you have that managed, then you can work on those borderline personality disorder issues. And once both of those issues are under control and you've learned effective coping strategies, you can change your life in amazing, amazing ways. And as you go through treatment, you will start to change your ways and change your life in amazing, amazing ways. And thank you very much for your time and attention. I appreciate it as always. And please subscribe if you like this video. You can check out some of my other ones, or you can learn more about me at my website. Whatever you're interested in, it'd be great to hear from you. And I hope you find this helpful. Thank you. Bye-bye.